Hi, Dr. Dave Jobs again. I'm here to talk to you about common myths in suicide prevention. For example, that every person that dies by suicide is depressed. That's not true. On average, 130 people have died by this evening at midnight by suicide. Maybe 40 to 50% of them will have depression. There are other mental disorders implicated: schizophrenia, bipolar disorder, anxiety, substance abuse. So not all depressed people are suicidal. Not all suicidal people are depressed. We also hear that people who really want to kill themselves can't be stopped, that we can't prevent suicide, something that's very determined. To some extent, that might be true, but as a clinical suicidologist, I know and have data that shows we can avert a suicide attempt or behavior by effective intervention. There's a myth that people who take their lives don't tell other people. Especially with young people, I think that's not true. A lot of times there are hints or even direct communications that are on us to pick up so that we can intervene and save lives. And finally, there's a huge myth that medication is helpful for suicide risk. There's not much evidence of that, or that a hospitalization of 3 or 4 days is going to be effective. Sometimes medications make things worse. Medications are helpful for certain conditions, but not so much with suicidal ideation and behavior. And there's evidence that a hospitalization might be followed by increased risk after the discharge. That's because we need psychological treatments that focus on suicide as the target of the treatment. So those are a few of the common myths that people like me try to dispel, and people like you need to learn about so we can make a difference in saving lives. Thanks.